Hi, everybody. It's Kevin and it's Donna, and we're so excited for you to join us on another episode of the Med List.
Yeah.
Today, we really have a guest that I always look forward to having back, not only because she's just a wonderful person, but also because we always get to have a few laughs prior to coming on to the show, which is so much fun. I got a little bit of time, Donna, down with the family over this weekend. Got to celebrate a birthday with a niece turning a big 4 years old. And on the way back, some laughs. I missed some appointments and meetings because there is freezing rain up in the Northwest and it changed some travel plans and whatnot. And so that's just one thing that I guess you just have to laugh about every once in a while. How about you? How was your weekend? Any laughing moments?
I got to spend some extra time with my son and just really enjoyed that time together. Had some surprise visits, so it was lovely. And, we have to cherish those times, right?
Oh, amen. That's so true. And I think that with the one piece that we can sometimes do to avoid missing out on smelling the roses, let's say, is we can really beat ourselves up, Donna. Like I didn't spend enough time with my son, or I wish I'd have been more present when I was there, or my resolution looked like it was going really well and then it fell off the wheels when I was going to exercise and lose weight and whatnot. So I'm really excited for Janet to be able to help us reposition our minds and then kind of give some action components on what can we do to get things right. So I will get things kicked off and we'll get Janet on it here so everybody can hear her astute wisdom. All right. Oh man, Don, you're doing a whole like virtual reality roller coaster on your side. For those that are listening on the podcast,
sorry about that. I was trying to readjust. I thought I could do it in time.
I was too quick on the poll. Housekeeping items for Don and I and the Med List. Yes, we are available on Spotify, on Amazon, on Apple Podcasts. You can follow us all there. We're on Facebook, on YouTube, on LinkedIn. And then if you name another spot where you want it, brother-in-law just told me, Kevin, why aren't you on Pandora? We'll try to find a way to be able to get there as well.
Perfect.
Super excited to
so like us and listen to us.
Yes, subscribe, like if Kevin can talk, like and listen. I think all those things are so much fun. And the only other piece, Donna, that I had a couple people ask me is like, hey, Kevin and Donna, like we know you guys, from family, LinkedIn, et cetera. But as you guys are gaining more viewers, do you want to do a quick kind of run through, Donna, on what are we doing here in general on the Med List? And then who are you? Who am I when it comes to just clinicians and our overall perspective? Want to do a quick run of that?
Sure. So, Donna Bartlett, I am a board certified geriatric pharmacist, and I have been just really wanting to work well with older adults, reduce their unnecessary and inappropriate medications to the point where I wrote a book called MedStrong. I was going to call it the Med List. That's my podcast. So MedStrong, shed your meds for a better, healthier you. And I have a workbook that'll be coming out in probably the next few weeks. So pretty excited about that accompanying piece to my book.
Beautiful. Yeah. So Kevin Walker, I was kind of in the pharmacy world and medicine world through a bunch of different roles as a hospital pharmacy director, working in digital health and technology. And really the push toward the Med List is through all these perspectives and views, and doing a geriatric residency is it gets complicated. It gets complicated for us. It gets complicated for our patients. And so Don and I, when we were together doing other things, we really thought it'd be nice to be able to have something that was very approachable, to be able to give to an audience of our family and our friends and our colleagues that they could gain some value from when it comes to them bettering the Med List. And sometimes, like our episode today, it doesn't have as much to do with nitty gritty details of drugs. It has much more to do with how do you avoid them and how do you do some other things to be able to help you on your healthcare journey. So thank you everybody for humoring us with that. We'll probably grab some sound bites for that on all those different platforms and plug those across. But without further ado, I'm going to add Janet on here so we can get into how do we find a way to make those New Year's resolutions sing.
And Janet,
hello.
Welcome. And
Thank you.
I am going to get into the nitty gritty of some meds as we go along because that's just what I do.
You do so well. It's great.
But welcome, Janet Huehls, clinical exercise physiologist. We are so happy to have you back. And as we always have our conversations because we are such wonderful friends for so many years. Um, what is it, 23 years now that we've been friends?
Yes.
It's just amazing. And
Crazy.
cherish all those days and all those walks and all those wow moments we've had. Because we are the women of well. That's what we've
We are the
decided.
women of well.
Wow. So we are wow, and we're
Yes.
going to wow you with all of this great information about being healthy and having good, healthy outcomes, and maybe rethinking exercise and rethinking the meds you take.
Yes.
Well, women of wow me with this one, Janet. I feel like when it comes to a punchline to a joke, it's usually what were your resolutions and how many months are you going to follow through on them? Like when
Yes.
is the gym membership going to be one of those other subscriptions that you just don't use
I
anymore?
know.
For you, Janet, when we kind of talked about this, I think it's perfect timing. We're looking at getting into February here really quickly, and I'm sure there's some hopefully really encouraged folks that are sticking with it, but also some that are discouraged, on just how it went overall. What are things that you see like in your practice that often cause people the most discouragement within these first few weeks of trying to make those
Mhm.
healthy decisions?
Yeah. I think there's a few things. One is that when we start January, it's like a rebound motivation from the stress of December, right? And we're feeling crummy and we're really annoyed with ourselves. And we're just like, we use that as like launching ourselves into motivation. And it's a terrible way to be motivated because we kind of lose our head. We don't really think clearly. So I think it's really important to take January. Maybe this is a moment to take the last week of January to kind of just pause and say, all right, what is really important to me? And like let the dust settle and let your body recover before you like dive in. Because I think that there's three mindsets or messages that are in the media. And in fact, I'm doing a mindset retreat right now on my social media to detox from the January messages about exercise. And there's three big ones. One is more is better. One is no pain, no gain. And the other one is you need someone to motivate you or something to motivate you.
Mm,
And those are three that feed each other. And they're very much from exercising for performance, for athletic performance. They work, right? If you're an athlete, you need to do more. You're probably going to have to deal with some pain and you're going to need a coach. You're going to need someone to push you, right? So they work for being an athlete. But most of us, I'd say 90% of us, really just want to exercise to be healthy, to feel
yeah.
better, to kind of function better, to age slower, to maybe lose some weight, but that's so that we can be healthier. So for the rest of us who just want to exercise for health and well-being, we need kind of the opposite approach. We need enough to feel better now. We need pain as a sign that something needs to change.
Yeah.
And we need to motivate ourselves because we're our most reliable source of motivation. I call it the inner trainer. You have an inner trainer that's way smarter than even the top trainer out there, even smarter than me. So, anybody, even with a degree, what you know inside is most reliable. And I think that probably what creates the struggle with the resolution is, I think, the misinformation that soreness is normal. Like, oh,
Oh,
I'm going to be sore. It's going to be so hard, but it's just part of it. And it means it's working. So it's good for me. And I've got to just get through those first few weeks and then it'll be okay. Every time we do that, our body is telling our brain that this thing you're calling exercise is something to avoid, which then feeds the industry that needs to motivate you. And the kicker
that's
is that there is no scientific evidence that soreness is needed or beneficial to make progress. Absolutely none whatsoever.
wow. That's really
Yeah.
interesting. In fact, for me, like former athlete me, hopefully still current athlete, I guess, from a
Yeah.
mindset
Yeah.
standpoint.
Yeah.
But soreness was very much a part of like, did I get a good workout in? Right. I
Mm-hmm.
mean, like, did I
Yep.
push myself? And I think
Yep.
that's a fascinating piece that I'd love to tease into a little bit, Janet, is
Yeah.
one of the biggest things that I've seen that is a hit a speed bump is comparator burnout. Right? When you either compare yourself to your former self, like I used to be able to do this and
Yes.
no longer can I. So now I'm failing, right? Or
Yes.
you're comparing yourself to other individuals. You're encountering someone in the gym that has been doing this for years and years, and you're wondering, they're my age or they look a lot like me. Why can't I do those kinds of things? I feel like that ends up being a really powerful demotivator for individuals to
Mhm.
go through on top of that any furthering, I guess, on that little element there that you've dealt with that before, Janet, and been able to help people to overcome it?
Oh my gosh, all the time. I love that saying. May I steal that? Comparative burnout. Comparative burnout. That's
As long as I
awesome.
get to be a man of wow, then yes, that sounds.
That'll have to be Mao or Mo. It could be Mo. Yeah, no, we'll let you in. We'll let you in.
Okay,
Absolutely.
But comparative, like you're saying,
Oh
is
my gosh,
tough.
so much so. Especially the comparing to, especially if you were a former athlete, because it's always like, oh, I used to be able to do this, now I can't. And when you identify as an athlete, that's a very, it's a big part of your life. And of course it like builds your self-esteem. Of course it's a positive force in your life that you want to stay attached to, because it just makes us feel good to play sports and be part of a team. There's got so many elements there that
Yeah.
are survival brain needs, like the tribe element and the, work for a goal kind of. It's got so many elements that make us identify with that and kind of fill so many needs that it's great. It's just not sustainable, right?
Right.
It's just not going to last. It's not meant for when we have kids and a job, and we just can't do that, nor do we need to be healthy. And so, yeah, I say when people are former athletes, they're constantly comparing themselves to what they used to be able to do and can never measure up to it because it's not what they're supposed to do. And usually when you're an athlete, you have some leftover injuries, right? Like, oh, the bum knee or that, shoulder that I tore or something. So, and as an athlete, and even as a exerciser, we are very used to using external motivators.
Yeah.
So how many steps did I get? How many miles did I do? How much weight did I lift? And how many, how fast am I going? And then we think linear progress. Oh, if I did this much, I got this many steps today, I should be able to do this much. And then I should be able to do that much.
Yep.
And that's how an athlete does have to train, because they do have to get to an external goal, because that's how they're competing. That's how we measure competition. And we want it to be linear, of course, because if we're going to work that hard and be that sore, we want to be able to see progress in that way.
Yes.
But again, that whole shift, I think we can stop comparing when we're exercising for well-being, because well-being is a physiologic state, and it's the opposite state of being stressed.
Yeah.
And in that state is when our health happens. So rather than thinking of it like a linear process, we think of it more like a flow. And I think of it like a spiral, right? So we're always either spiraling up, we're always either like improving something and getting better at something, or we're spiraling down. Our body is a use it to keep it system. So I might improve my strength, do strength training really consistently, and then I might get COVID and be in bed for a week, and I might lose some strength and start spiraling down. If you think about that as a spiral, you can think, okay, what can I do to at least stop that spiral? What could I do to at least maintain my foundation so that I'm not spiral? Oh, there we go. I'm doing hard. Sorry.
You are. Look at you. All right.
Can you guys see that?
Yeah.
Yep. We can.
So I think of it more like a spiral. Like, what could I do to mitigate the spiraling down, rather than thinking of it as, oh, I've lost it and now I've got to push hard to get it back.
Yeah.
It's more like, how do I keep myself in that state of well to help myself heal, right? So can I do some like mindful, very low level stretching to help with that anti-inflammatory process? Can I do just some strength movements very slowly and very mindfully to keep the muscle memory for those strength movements? And that movement that makes you feel better, often it feels good as you're recovering from something. It just feels good to move. But we often might not think, well, this isn't worth it because I'm not lifting what I used to lift. So what's the point of doing this? Well, the point is you get to keep muscle memory. Yep. And muscle memory is the foundation of strength. So if like I was sick last week, I had a cold, and every day I just went through the 6 strength moves, basic strength moves, and just practiced them. So I kept my muscle memory. And then when I was ready to get back, I just did 1 set, very, very lightweight, and then a little bit of cardiovascular exercise and a little bit of everything, right? Mm-hmm. And then the next day I did just a little bit again, and then I kind of got back to lower. So you step back up, but you can get back in that gradual process much faster than if you think, I'm going to wait until I get back to what I used to be able to do. Right? Oh, I can't go to the gym yet because I'm still feeling crummy. Well, if I do this a week before I can maybe get back to what I used to do, I'm gonna maintain that, and I'm gonna be able to get back faster. Plus, I get to help the healing process.
Interesting.
So, so using movement to get out of that stress state, to burn off some of that tension, to kind of get some fluids flowing, you're helping the healing state. And that way you're well, even if you're sick, So thinking of exercise as a resource rather than a task.
So Janet, I am
Yeah.
going to keep going on that, not necessarily feeling well. I'm going to go to the hospital setting right now where people just are lying in bed, not really moving. And I had that, not me personally, but my mom had been recently in the hospital. And when we were there, I was just like, Mom, you got to start moving your legs. Just move your legs, just knees up in the bed. Come on. And I just had to start doing that. And then when she was sitting up, I was having her doing sit marches. And then I was having her do these things. She was smiling. This 90-year-old woman's just smiling away, doing all these exercises with me. I had the nurses talking about, did you see that woman in the room with her mother? You got to see what she's doing. It's like amazing. She needs to be with every single one of our patients. And I was just like, this is what we need to do. This is part of our treatment. We got to move people, right? So it made me think for a little while in regards to that morning. My mom had a very, very difficult time even standing to get up out of bed. And after visiting with her for a couple hours and every, couple few minutes, I'll be like, all right, Mom, come on, let's do this now. And I would like be marching her, having her kick her legs or do whatever. And then I had to practice standing up and sitting back down while I was there helping her. I didn't walk with her because I know that they did not want me doing that myself. And I understood that, but I got her up to stand up. And it took a few tries, but we did it. And then I said to the nursing group, hey, Mom would really like to go for a walk. I said, so when you get a chance, if we could have her go for a walk. I said, I'm assuming you don't want me to walk her. They're like, no, you're not walking her yourself. I was like, okay, fine. I figured as much. And so two of them came like, okay, we're going to get you up and walk. And they were both a little bit nervous because they had tried earlier that morning and it was a struggle. And she got right up and walked down the hallway and walked back. And they were looking at each other going, unbelievable. And I'm like, no, it's just movement. It's like you're talking about just doing those movements. If you don't do those little things. So I just want to share like what your message is, Janet, is that you can really start exercising at any age, and sitting and doing this is medicine. It made her so happy and engaged and feeling like she could do something.
Yes.
And then we've continued it ever since she's been back home, just to keep her strength up so that she can continue to walk.
And you changed the course of her life. I mean, you literally did. I think she was at that point where if she stayed in bed another day, she would lose enough muscle memory that it would have been just that much harder and that much harder. And then it would have been, okay, she's got to go to rehab. She can't walk. Like, you caught her at that moment. And the way you did it, very gradual, so that she had little success moments. So psychologically, it helped her not be afraid. It's like, okay, I could do that. So meeting yourself where you are is rule number one, right? So saying, okay, can you do that? Yeah, that feels good. Okay. And the fact that she was smiling meant that it felt good. She wasn't grunting through it. And that built that self-efficacy. And that self-efficacy is huge. It's huge for motivation, but it's also huge for that brain body. And then what you did is that muscle memory. And that's what we forget, is that strength is muscle memory. What we lose, when we lose muscle, we're not losing muscle fibers. We're losing the connection between the nerves and the muscle fibers. And so that doesn't take weights to keep. It just takes mindful movement. It takes thinking about what you're doing. If she did it mindlessly and just kind of like, okay, move your arms while you're watching TV, you're missing out on that brain body connection. So you focusing on her, looking at her, you had all the elements there. And it didn't take much, but it turned the corner for her. And you're right. That's what we need to be thinking of.
I definitely saw that too with her age. There was definitely a mind movement misfiring, if you will, that you could tell she wanted to do something, but she just couldn't. And then you're right. When she got that muscle memory back, she was able to do all these things. So that's that's really hits home. And so with that, again, and I also want to touch on some other meds too, but this is what we talk about. We got to get people off the meds that are going to be problematic to help people move. Things that have a lot of cognition issues, things that make you fatigued and tired and just not feeling well at all, those all central
Yeah.
nervous system meds.
That makes a ton of sense. I think that what you just mentioned there with your kind of recounting of just movement and how powerful that is, even looking at the comparison issues that people can encounter early on with a New Year's resolution is you don't have to enter the Paris Olympics in 2024. You don't have to be record breaking, right, to make a huge difference and impact in your life. And I think that, like the Herculean lifts that we often do to ourselves and go, I can't do what I did before, but can you do more than you could do yesterday, right? Or continuing to build upon something, I think is a really nice mindset component, Janet, to really lift us off things. But what you're getting to there, Donna, at the end, I think is also really interesting because we talk about drugs that keep us from being able to move the way we want to and just take those first literal steps. The other thing Janet mentioned is, and you mentioned as well, is what does it do when you move? Like that's one thing, Janet, I don't think folks maybe understand as well. I don't want to get too detailed into the science of inflammation, et cetera, but just when our bodies go from a stagnant state, right? When we're noticing that we've got soreness and tiredness and muscle ache from sedentary life, what does just moving, what does that do for our bodies? For those that are struggling, going, I'm not lifting 100 pounds. Well, don't worry about that yet. Just listen to what Janet is saying. It's just what for you.
Yeah. And even lifting 100 pounds will just add to the inflammation. So I think of it like a continuum, right? Exercise can be a pro-inflammatory or it can be an anti-inflammatory. We've got to find that sweet spot, and that sweet spot is individual. For Donna's mom, it was just a little bit that made her smile, and for someone else, it might be a little more, but only that. That's why I think the inner trainer, right? So not even comparing yourself to before or yesterday, especially if you've got other stuff going on that's influencing your pain levels and your energy levels. Those might be up and down because the pain might be caused by other things. Energy might be drained by the healing process. So what I think pain and energy are your best guides to know how much is enough. If it decreases pain, then you're decreasing inflammation. And that includes muscle soreness. And if it gives you energy, doesn't take away from your energy, then it's helping you to get back in that well state rather than keeping you in the stress state that's going to take energy away from healing. So if you use pain and energy as a guide, you cannot go wrong at all. And I always think of it like that foundation. So sometimes you always think about what's the most important part of anything, building a business or a building, the foundation, the business plan, the structure that holds everything up. And that's our muscle memory, and that's our ability to do movement. So like when you're exercising, so my vision is to redefine exercise as moving for self-care. Rather than defining exercise by what you accomplish or how many calories you burn or all of that, redefine exercise as moving for self-care, which could be, I just take my arm up and stretch. And when you stretch or forward or whatever you do, when you stretch, that's creating a little muscle contraction. And that muscle contraction is pushing on your lymphatic system, and it's helping to move lymph, which helps to metabolize and lower inflammation. So often people think, oh, I'm stretching muscles, but really what you're doing is helping your lymphatic system and your connective tissue get a little more elastic. So that stiffness that you mentioned starts to dissipate because the connective tissue and the lymphatic system gets a little bit of help in all these different areas, your feet, your hands, your face, your neck, all these areas. But it doesn't take a big stretch to do that and like really force it. It's just, oh, that feels good. And when it feels good, it's good for you. When it feels good, it's good for you. That's really, really important. When it doesn't feel good now, it's not going to help you in any way be healthier or more well. So even not comparing to how you feel now, the comparative thing, right? The only comparison is, how do I feel now? And how do I feel as I'm doing this? And how do I feel afterwards? If I feel better, that was exercise for self-care. That was moving for self-care. It was exercise, and it helped you get healthier.
Wow. And, Donna, I was curious on your thought here is that next piece of comparison that I was going to go with is, what did I look like before versus now? Am I making gains in, hey, there's too much flabbiness here, or I'm not losing the weight, because there's lots of drugs, Donna, that you and I are encountering now that there are shortages for that exact reason, that someone says, it's a new year, I'm going to start on this new drug because it's going to help me lose weight. And we know the benefits, Janet, are not there when you don't incorporate going through those movements, going through exercise, doing lifestyle management and change. Any other tidbits on that one, Donna, of just our mindset is, I want my body to look different and look this certain way, and so I'm going to use that drug to help me?
Yeah. Funny you should say that, Kevin. Our minds are right on the same point. So I just read this article today, and I was shocked with what I read. And I'm going to tell you a little bit just about what it is that I was reading. It was exactly about this, the weight loss meds. And I think everyone is reading now how the newer meds, they only work for a certain period of time. And then you hit a plateau. How many times in our lives have we heard about the plateaus, from the tab diets to keto diets to whatever? It doesn't matter. We have heard plateaus ever since we can remember. So now what they're doing, and this is the part that really got me, is adding on weight loss meds to med that aren't working anymore. And I'm like, this is exactly what I don't want to happen. Is like, all right, so you plateaued on this drug. Let's keep that one on. And now we're going to add on another one, an older one that worked before for some people for a little bit of time. We're just going to add that on. And then once you plateau on that, we're going to add on something else. And I was really surprised with this information, to the point where the prescribers were saying that it's just like hypertension, where you might need a few meds in order to lose that weight. You need a few meds to reduce blood pressure or something. And I was just like, I don't know. I don't necessarily agree with that. I'd have to do more homework on that. It was very shocking for me. So Janet, I know that you do a lot of work with people trying to lose weight and helping folks kind of get back either before or after maybe surgery or other things that they try. So just curious, have you seen this? Have you seen the multiple weight loss meds being put on a person at the same time?
I was just at a conference on Friday, and it's exactly what they were presenting. Here's the strategy, exactly what you just said. And in my mind, so here's the thing about weight that is not the same as blood pressure or diabetes. Weight is a guess. We're guessing how much body fat you have. We're guessing how much muscle mass. We're guessing the body composition when you get on the scale.
Sure.
So it's always going to be a guess. It's never an exact measure. Blood pressure is an exact measure. Blood glucose isn't an exact measure. Cholesterol is an exact measure. Weight will never, ever, ever be an exact measure until we only start doing body composition and make sure that it's reliable.
Yeah.
So all of these studies are looking at weight, and the weight plateau is usually because that person lost so much muscle, their metabolism came down. Now their body is saying, hold on, this is not good for you. I'm going to hold on to fat. It's not good for you. You're losing muscle. You're losing strength, and you're losing it too fast. There must be a famine. There must be something really bad going on. I'm going to protect you. The plateau is not a bad thing. It's only bad when your measure of success is the scale. And again, that measure of success is not a real measure. So until we accept the fact that the scale will never, ever, ever be a real measure, all of these studies that are using weight and BMI as a marker of success, or all the people who are using weight as a comparative marker of success, I want to get back down to what I was in high school. Your body is not the same composition as when you were in high school, especially if you've lost weight, or you were on prednisone, or you were on bed rest, you've lost muscle mass. And if you're not doing strength exercises, so the number one thing is doing strength exercises and good quality strength exercises. I can give more detail about what that means. To have a little insurance policy to make sure you're holding on to muscle mass, no matter what you're doing. But yeah, I think it's all built on very shaky ground about weight. And I'm telling you, this conference nobody was talking about that.
I love that, because I think for anybody listening, that hopefully for you is very encouraging, that it shouldn't be just the scale. right? In general, like if
Yeah.
you're looking at the scale and you're looking at a couple components of body conformation, you're looking at
Hmm.
areas under the arms, you're looking at areas
Yeah.
under the
Yeah.
back or the hips or wherever the
Yeah.
case may be. Sometimes in general, those are very difficult areas to lose adipose tissue from, fat from,
Yeah.
right?
Yeah.
So if your guide is just, what does that scale say? And what do these certain areas say on my body? You're not helping yourself overall, right, Janet? And
No.
one thing though, I'd love for you to give us some insights on is we do know that weight, when it is correlated directly to someone having a, their muscle mass or their hip to waist
Hmm.
ratio, showing that yes, you
Hmm.
have a significant amount of adipose tissue we need to be able to bring
Hmm.
down. For those individuals that are trying to, like, I love movement. Like, I think movement is so
Yeah.
important, especially different stages
Yeah.
of life. We want to be able to move, to feel better about moving, to be more
Right.
successful, to avoid falls. But what about when someone has that additional weight on board, causing stress to their joints, etc., and you want to be
Yeah.
able to offload a little bit of that weight, and folks are struggling right now? What are your tidbits and pointers for
Yeah.
them to be able to get back on
Yeah.
track there?
That's such a good question, Kevin. Because I think people always think, oh, I've got to burn calories to lose weight so that I can get out of pain. And they end up pushing through pain. And they always think cardiovascular exercise is the best way to lose weight. There's three types of exercise. There's strength, there's mobility, and there's stamina or cardiovascular exercise. Focusing on mobility and strength in a way that you're doing a very slow, gradual progression. When you do mindful stretching, mindful mobility, you're using it as a nice anti-inflammatory. So that alone can reduce a lot of pain, especially back pain, when you do it correctly. And then focusing on strength exercises after that. So you start with mobility, then you add good, mindful, good quality functional strength. Now, I'm not talking about toning, losing weight in these certain areas, right? That's what most of the strength exercises are online. Oh, I got to tone my core. I got to get rid of here. And you can't do that. It's not how our body works. But
Yep.
movement-based strength exercises that use a lot of muscle build up gradually. Intensity is really important. You want to gradually build up to the point where you're feeling like, yeah, that was a good challenge, but never, ever, ever sore. Never sore. Not from day one. If you're doing it right, you're never sore. And so if you do mobility and strength, you're going to raise your metabolism, you're going to lower inflammation, you're setting up your body to help you lose weight in a way that you're not going to increase pain. And then when your body feels better, then start doing very small bouts of cardiovascular exercise in a pain-free range. So if you're always exercising in a pain-free range, you're getting a nice balance of those three types. You're following movement science principles. And I have this all outlined on my website, like for free, plenty of videos that give all this information about what's good quality strength, what's good quality, what's enough exercise. And if you follow those movement science principles, you'll be able to exercise without pain. You're going to function better. And there's really good evidence that no matter what your BMI is, if your fitness level is at a good functional level, meaning you can climb 2 flights of stairs without stopping because of shortness of breath, that's kind of a poor man's stress test to say you've got enough cardiovascular fitness to protect you from disease. If
Yep.
you can get up out of a chair quicker, like a sit-stand test, grip strength, those are real, true measures that have a very strong correlation with longevity and morbidity and mortality. And so focusing on function rather than the scale will give you another measure of, okay, am I healthy? Because there's really good studies about, okay, higher body mass index, but people who are exercising regularly have a lower risk of disease than people who have a lower body mass index who are not exercising regularly. So exercise can give you that power to be healthy. Sure, if you want to lose weight, absolutely, do the other things to lose weight. But if you improve your function in a really smart way, you're going to feel better. You're going to lower your risk of disease and, slow the aging process. You're going to take care of a lot of those frailty issues. And you're just going to feel better overall, mentally, physically, emotionally. And that's going to set you up then for making some dietary changes and doing less emotional eating and all of that. We often think, oh, diet's more important. It's really hard to take care of a diet when a lot of it is emotional eating, just eating
Mm.
more than your body needs. And it's usually because of emotions, when what we need is exercise that helps us to get out of that stress state so that we're thinking clearly and can make choices based on how
Wow.
hungry we are, So I think we've got to think more about diet and exercise working together and think smart about exercise based on physiology.
Donna, did you see a video that Janet recently did? I was going to send it to you, but she did a wonderful video, folks that are listening, on how to shovel snow. And I just feel like what Janet just went over with us is she does a good job of encapsulating that all in that video. So we'll try to put it in our links here. But I love, Janet, that, when you're talking about that video, not only are you trying to get people in the right mindset for going and doing the activity and how they're thinking about doing it, but also trying to dispel some of the issues of, what is it? Lift with your legs instead of going, no, you actually want to do hinging, and use these techniques will allow you to be successful, still move the same amount of weight, but do it in a way that you will not experience the same level of frustration and pain. And I think you can take those mantras that you built into moving snow around into all exercise for you to be able to get more benefits from. So I love it. I appreciate that.
Thanks. I do have another video that's how to move well. It's those steps. And that would be a good one to link because it does give you those 3 principles and what I applied to the moving snow, but you can apply it to anything and it keeps you strong. And it doesn't take much to maintain that.
Yeah. I have my inner Janet going pretty often. Yeah. Pretty regularly.
I have my inner Donna in there too,
that feels so good. Janet, you said that was going to feel good. It feels so good. So I often have my
good. I think, Donna, that brings me right to the piece that I wanted to ask you both about, especially today, is let's say someone jumped on board, right? They weren't discouraged initially. They jumped on board. They were exercising. We talked about this pre-show in some of our exchanges. But the problem is they ended up pushing themselves too far, right? And now they're hurting. They're immediately going like, where can I go in the medicine cabinet and grab something to be able to help myself to get through this pain? I guess from 2 perspectives. One, Donna, from our medication world and the med list in general, like what things they need to think about when they're reaching there. And then Janet, if you can also kind of answer for us, what non-medication things can they reach for to be able to help with that would be amazing.
Yeah, I like the non-farm side, actually. So, it all depends upon who the person is and what other medications they might be taking, how well their kidneys are functioning, how well their liver functions. So that's all going to matter. But of course, we tend to have our acetaminophen or our NSAIDs, just such as ibuprofen or naproxen, that are readily available over the counter. So with acetaminophen, that actually does not have any anti-inflammatory abilities. So it's just pain for that. So that may or may not be helpful for people who might have inflamed response to doing too much. The difficult thing about the NSAIDs is if you have any cardiovascular issues, if you have high blood pressure, if you have heart failure, if you have kidney issues, it really is not the product for you to be using. So that's why I say I really like the non-farm approach because there's not like a blanket answer. So ask your pharmacist when you're at the pharmacy or see if there's an issue or, just be wise. Look at the containers. I know that writing's really small, but see what it says. See if what you have is appropriate. And the other thing is, please don't take anything that has the PM next to it, especially if you're older, because that PM is typically diphenhydramine, which can increase your risk of falls. So we know you're getting stronger, but we don't want you falling while you're doing it.
Yeah, I think there's drug interactions that Donna's, really pointing to there when it comes to those NSAIDs, what you're taking, the bleeding risk related to it, the kidney problems, acetaminophen. Too many folks don't realize there is Tylenol/acetaminophen in lots of products you could be taking. So watching to make sure you're keeping it under 3,000 milligrams a day is an important piece for individuals' health. And then the other element that I think is interesting, Donna, and I'd love to get your thoughts here before we switch over to Janet, which I am much more interested in. I mean, I love the icing and movement, and there's so many other things that we can do. But turmeric, there's been several articles about leveraging something for anti-inflammatory processes. Turmeric has a lot of good data behind it that I think is one that we just don't think of often. We think, what, I want to go to those tried and true. No, not really tried and true. Medications commonly used and prescribed in acetaminophen and ibuprofen. When there are some other alternatives to be able to look toward, we can cover it.
Again, though, I think it's important to look at drug-drug interactions and drug disease interactions and be safe with whatever you're choosing to take. There's a lot of things that you can use online, such as drugs.com, I believe, has a checker available for it. So Interaction Checker, and also Med Stopper is another one that is available. So you could plug your meds in there and just see if there's a potential interaction that you would want to be careful of.
Beautiful, beautiful. Jana, off to the more exciting piece. How do we do it without drugs?
Such good information. You guys are just a wealth of knowledge, because people think, oh, I'll just pop ibuprofen, no big deal. And, it's just, I love listening to this stuff. It's so good. I think the number one thing is to prevent soreness by following the rules. Do a slow progression. That's the number one thing. I mean, we're going to end up sore, like going cross country skiing with your friends, and it's something you haven't done in a while. You're going to end up sore. That's okay. So when you do end up sore, then mindful movement is an anti-inflammatory. So just moving, it doesn't have to be like intense stretching, because again, that can it can be too much. Just mindfully moving. But the mindfulness piece is really important, because if you're stressed while you're doing oh, I got to really stretch out that muscle, that's keeping you in the stress state, which is a pro-inflammatory. So pause first before you move. Take a moment, get your body in alignment, feel your breath, kind of get in the present moment, and then just start moving. And when your body says thank you, pause there. When it says no thank you, move along. And that's, I call it thank you positions and no thank you positions. It says no thank you, you just move past it. When it says thank you, you just stay there. And it might be like a little whisper of a thank you, or it might be like a big loud, yes, please stay there. That's exactly what I need. Stretching it's all connected. So if you stretch your whole body, like if your legs are sore and you cannot even move them in any way, stretching your upper body, stretch your spine, stretch your feet, stretch around the sore area, especially if you've got back pain. Stretching around that area rather than going straight to the area that's sore can do a lot of anti-inflammatory globally in your whole body. So whole body stretching, doing it mindfully is a great way. Yes, some mindful movement, and then just time. You've got to give it time for that inflammation process. It's a healing process, and the pain's there to say, I got to stop you because there's a lot of damage here, and I've got some healing to do, and I need you to stop making it worse. And so pushing through soreness and even taking ibuprofen to be able to exercise. But I think we can cut down on a lot of painkiller use when we realize that soreness isn't normal. And if you're medicating to exercise, then you've got to look at what you're doing. If you're taking a painkiller to exercise, you've got to look at what you're doing. And it's hard, like you said, you're comparing yourself. So it's really hard to swallow that pill, metaphorically, to say, oh, I can't do what I used to do. That's so hard for our self-esteem.
Yes.
But when you say, you know what, but this is where I am, this is hard, a little self-compassion there is great. And I'm going to take care of myself by listening to my body. Buddy, what can I do to help you right now? And use pain and energy as your guide. And if you listen to those things, you probably won't need a lot of medications. But really asking yourself, if you're using medications to exercise, what's going on here? What am I doing? What's the end goal here?
Yeah. That's super helpful. And I think that you mentioned one thing that I wanted to tease into a little bit is you talked about you have localized pain, in a certain area, instead of jumping right into it and going, I'm going to stretch this out, or I'm going to fix it with a one punch or another. You talked about just working around the individual area, which is so funny because in my mind, when I'm trying to think of how do we do the exact almost opposite in terms of pain control, Dawn and I are always trying to go, let's not give a systemic drug. If you can do a topical, if you can use something you can apply to the area and make sure that area is getting what it needs, quote unquote, what it needs, then hey, even better. And there are things out there like diclofenac or Voltaren that are oftentimes in inflammatory conditions that can save you a little bit additional exposure to your kidneys, et cetera. Icy hot and some things that you see oftentimes used. The interesting thing about all of those, Donna, and you've probably read the studies, is just the massaging, and the touch. Sometimes being can't be just as effective as the medication itself. So, Janet, I think that those are just really fascinating when it comes to movement and moving overall. What would be a good, since I think that's been the theme of the show, when it comes to doing a moving kind of exercise, a moving kind of stepwise process, I'll call it, instead of exercise.
Yeah.
I know a lot of people are scared of yoga, in general. They're just like, oh, that's not for me. Yoga is something I can't move like that. I can't bend like that. I can't stretch like that. And for me personally, there's been nothing that has been, you said your body says thank you. There's been a couple of yoga poses that I'm like, oh Lord, like that is amazing. My whole body's like, well, why don't you do this more often? And,
Yeah.
I wonder how many folks experience that, Janet, with you when you help them go through that. Is that an epiphany moment that you've seen?
Oh, it's the best epiphany moment. It's what keeps me doing what I'm doing because, like, if I have someone with knee pain, I teach them how to get out of a chair using the movement mechanics, or just a simple stretch, And you'd think I took them to a spa, and they're like, "Oh, that feels so good," And it's the best, and they realize, "Oh my gosh, I could do that all day long." Yeah, and I think with yoga too, like if you're flexible and you've done a little yoga, but I think of yoga as a level 3 stretching. So level
Okay.
1 stretching I categorize as just range of motion, right? Level 2, holding in a thank you position. Level 3 is when you're combining movements. So my legs are spread apart, my arms are up. Like that's combining mobility movements. And you've got to work your way up to that. If I ask my legs to go up and my arms go up, then that's a lot for my connective tissue to do all at once when it really hasn't. And likely it's going to take you out of alignment. It's going to strain something if you're not used to doing it. So I don't think
Helpful.
yoga is something to jump into. I think yoga is something to kind of work up to. And then,
Yeah.
yeah, it does feel great when you do it correctly. It feels so good. So you must be doing it well because your body's saying thank you. That's nice.
I need to keep doing it better than I am right now, but he's my motivator, so that's really helpful, I think, with those stretching pieces there, Janet. And at least for me, when it comes to how am I going to change practice and the way that I'm thinking about things after talking to Janet, I really think that the next piece is I know that you have a ton of resources on your website. If someone's saying, I have this particular pain or I have these kind of issues, where can they look and find, like, here's the movements you should do, or here are the stretches you could do? Because anyone can do a
Yeah.
Google search and find the wrong thing to do, right? They could end up
Yeah.
hurting themselves or something can go wrong. Can you help our audience to kind of understand where are the right places to go to find some of those
Yeah.
phase 1, phase 2 pieces you're mentioning?
Yeah. So if it's like a specific injury, like you have plantar fasciitis or you've got a shoulder injury, there's a few physical therapists that have really good websites. I like Dr. Joe is one of them, and the other one is the prehab guys, and there's a ton of stretches on there. And
Awesome.
so yeah, PTs have this knowledge base that's just so in its own category. Like it's just very specific for joints and connective tissue and all of that for injuries itself. So when you have an injury, I would definitely go to a PT or at least start looking up things that you can do. And if they feel good, keep doing those. Oftentimes you can just start with those. If they feel good, keep doing those. But a PT can give you that very specific evaluation that is so important. And then I think the gap, which is really what I'm trying to fill in my work, is you get out of PT, they give you all these exercises, but how do you take that into a really well-rounded exercise program that's for your whole person health? There's nothing that's doing that's science-based. There's a lot of fitness stuff out there, but it's not science-based. And there's nothing to take that gap, or even like Donna, your mom getting out of the hospital, what takes her from I can walk in the hospital to now do an exercise program that's going to help me continue that, there's really a gap there in that. And that's the gap that I try and fill in my work, that I put online. But yeah, I would look for a good quality PT, degree professional, and then trust your body. If it feels good, it's good for you. If it doesn't, don't push through pain.
Yeah. And Janet, your website is exercisingwell.com.
Yep.
Yep. Exercisingwell.com.
Yeah.
So
that's YouTube. I've been doing a lot of YouTube videos and a lot of blogs. So lately I've been posting a lot, again, as part of that mindset retreat for January to kind of counteract a lot of those messages out there that just aren't helpful for those of us who want to be well.
Yeah.
Awesome. Well, I love it, Janet. Any parting words, Janet, for the audience when it comes to kind of wrapping up the New Year mistakes and some of the things we've kind of walked over? So helpful.
Yeah. I'd just say, like, take a really good evaluation, like learn from what you did, what worked, celebrate what worked. What are you feeling good about? What's helping you feel good? Like, trust that. And then things that aren't making you feel good, that you're not feeling confident about, learn from that. Don't think of them as failures. If you did it for a week and it didn't work, I love the FAIL acronym, first attempt in learning. Think of it as, that's what FAIL stands for. And so think of it as, okay, what did I learn from going to the gym every day? Oh, that's not sustainable. I can't do that. I don't feel good. What do I need to do now? How do I adjust? So think of it as just self-correcting rather than it linear. Again, it's spiraling up or spiraling down. Yeah.
So Kevin, I'd love to also mention a couple of things that just from the very beginning, when Janet was talking about some of the myths, if you will, of, oh, getting into the new year, more is better. And how many people think of that with medicine, right? More is better. No pain, no gain. Well, if I'm taking medicine, I'm going to have some side effect. No, you don't have to. It doesn't it doesn't have to be that way. I need to be with someone else. Like, I need to see a specialist. I need to see the next person and the next person. And when really it could be medicine that could be causing some problems. Pain is normal, side effects are normal. These are not, I'm getting older, I must be on a lot of medicines, or I feel this way because I'm older. These are all myths. They don't have to be this way. And thinking about medicines and thinking about better exercise and just rethinking all of this, rethinking the meds you're taking, rethinking the exercise, and whichever way it goes, exercise to deprescribe or deprescribe to exercise, we got you covered.
I love it. Love it. That's a fantastic wrap up. And those myths are brutal. Like they just allow so many people to stay in that exact same mindset and not move on to the next step for themselves, which sometimes involves a little bit more intuitive elements Janet's mentioned of just feeling your body out and recognizing, why am I feeling different? And I think that if you get anything from Dawn and I, it is always blame your meds first, right? Just find a way to say, you know what, it's probably the meds, and look into that, tease it through, because more often in my career than not, it has been, which
It's
is
not age.
Yeah,
it's
no.
not age. Well, amazing. Janet, thanks for all your wisdom as always. We
Thank you.
appreciate you listening.
Wow.
All of Janet's connections down at the bottom, and her website. I will post the piece on lifting snow. We've got a little over a foot still up here in the Northwest. So for those, oh boy, next snowstorm's coming, you can listen to Janet breaking down how you should do this the right way. And hope you guys have a great rest of the new year. Kind of enjoying this first part of it, and still stay on those trains and get over those bumps, because it's worth the movement and worth all the benefits for it. Have a wonderful rest of the day, and we'll talk to everybody soon.
Thanks, everyone.